Today we're going to continue with our question about the lines of evidence that allow us to conclude without any reasonable doubt that acetaminophen use in susceptible babies and children is causing many, if not most, cases of autism. We've already talked about two lines of evidence. Now we're going to talk about the third and the fourth line of evidence. Now, the third line of evidence is built on a number of studies, over a dozen studies now, looking at use of acetaminophen during pregnancy, particularly the late stages of pregnancy and its association with long-term problems in neurodevelopment, including ADHD, developmental delays, and autism spectrum disorder. So all of the studies have been published, show that heavy use of acetaminophen has an association with, during pregnancy, has an association with these long-term developmental problems. But the risk is not what we would call super high. It's maybe 10 to 20% at the most, and it has to be heavy use for certain issues, and it has to be heavy use of acetaminophen. So the overall risk is fairly small and probably doesn't account for more than 20% of the cases of autism today. So this is only one line of evidence, even though it's a number of different studies that come from a number of different institutions. Now, the second line of evidence is more specific. It's looking at how much acetaminophen is in the baby at the time of birth. So when understanding what's going on from our third piece of evidence, which is dealing with use during pregnancy, to our fourth piece of evidence, which is what's going on at the time of birth, it's important to understand that when the umbilical cord is cut at the time of birth, the mother's liver is no longer there to help out. Now, mother's livers are known to be very efficient metabolizers of acetaminophen, and babies' livers are known to be very inefficient metabolizers of acetaminophen. So you sort of go from daylight to dark as soon as you cut that umbilical cord. So our fourth line of evidence is looking at this incredible association between 3- and 4-fold increased prevalence of autism when the baby at the time of birth, and they measure this in the cord blood, which is shared by the baby and the mother, when the acetaminophen levels in the cord blood are very high compared to very low. So you get this 3- to 4-fold increased risk in autism. It's a huge amount of autism. That's our fourth line of evidence. And it adds in with that third line of evidence telling us, yep, the drug is dangerous. It is causing neurodevelopmental problems, but it's more dangerous at the time of birth than it is during pregnancy.